Good afternoon and welcome. Welcome to Grand Reunion. Welcome back to campus. We're really happy to see you. You can't hear me? I'm just going to take it. Is it on? Okay, I'll just talk quiet. I talk louder. Welcome to campus and welcome to your Grand Reunion weekend. I hope you're having fun so far. And welcome to this presentation from the Markkula Center for Applied Ethics. My name is Leslie Leonetti. I'm also an alum, class of 73, and I'm happy to welcome you to the talk of AI in healthcare, promise and peril for patients and society. That's just in case you're not here for that talk. You want to go somewhere else? Now's your time. I also want to welcome our speaker, Guadalupe Hayes-Mota, the Director of Bioethics at Santa Clara University's Markkula Center for Applied Ethics, where he's building a justice-first bioethics program for our students. Guadalupe is an MIT and Harvard graduate with degrees in business, public policy, and AI. And he's now completing a doctorate in AI and machine learning. He bridges technology, ethics, and global health. Guadalupe has advised the NIH, OpenAI, the European Union, and the World Economic Forum. And he previously taught ethics of biotech innovation at MIT. There's more. As a founder of Healer Solutions, he scaled AI-powered drug access to 43 countries, and his leadership has reached over 2 billion patients worldwide. Guadalupe is a Forbes and Fast Company contributor. He's been named among Business Insider's most powerful LGBTQ plus executives, and he continues to shape the ethical future of AI in medicine. We're really happy to have him teaching at Santa Clara and at the Markkula Center, and please join me in welcoming him now.
Well, thank you so much for that kind introduction. Can people hear me?
Yes. Yes.
Awesome. So I'm going to start first thinking this scenario. It's 2 a.m. in the morning, and a single mother in a sitting room in her kitchen is holding her phone. Her child is sick. She opens an AI app, types, "What should I do?" In seconds, an algorithm replies. Not a doctor, not a nurse, but a line of code. That moment captures the future of healthcare, and it's already here. AI isn't coming someday. It's already diagnosing, prescribing, and advising patients every hour all over the world. And yet, every question we hand to AI carries another questions back to us, such as, can we trust it? Who does it serve? What happened when it gets things wrong? This talk is about answering those questions, not with fear, but with ethics, innovation, and hope. AI is reshaping healthcare faster than any technology in history. It's diagnosing diseases faster than specialists. It's predicting epidemics before they even spread. It's empowering patients in ways we once thought was impossible. But speed without ethics is a risk. Precision without compassion is a danger. Because in medicine, a wrong answer isn't inconvenience. It can cost a life. That's why on Wednesday, I just published a CARES framework in Forbes, a guide that builds AI systems that truly serves humanity. This framework will go into with the talk. We'll talk about what exactly it stands and how can we use it in AI for a better future. Over the next 45 minutes, I'll take you through a journey through 5 parts. First, we're going to talk about what is AI doing right. So what are we doing right now that the miracles is already doing? Second, what can AI do in the future? What are the promises that it can bring to us? Third, we'll talk about the perils and ethics, the questions that we face into the future. Fourth, we'll go into that CARES framework that I talked about, trying to give us a direction of how should we move forward with AI into the future. And fifth, we'll talk about the future of a human-centered innovations. How can we create this to be human-centered at the end of the day? And this is important because the future of medicine won't be written with code alone. It'll be written with our own values. So let's begin with the good news. Before we talk about the future and the risks, let's recognize what AI is already doing right now. From hospitals to homes, algorithms are catching diseases earlier, improving access to care, and empowering patients to take control over their health. This isn't the future of medicine. It is already present and happening right now. First, AI now can help clinical breakthroughs to make doctors see things that they couldn't see before. An example of this is Google DeepMind AI detects breast cancers with greater accuracy than expert radiologists, cutting false negatives by 9%. That means thousands of women who might have gone undiagnosed are now receiving timely treatment. It doesn't replace the radiologist, it augments their vision, turning hours of images analysis into something they can do fast. AI pathology tools at Harvard and other institutions now identify rare cancers and genetic mutations with extraordinary precision. These systems just not only spot the diseases, they help tailor treatments to the individual patients, guiding physicians toward the right therapy faster than ever before. One Harvard team found that AI could even predict a patient's likelihood of survival based on microscopic tumor images. At Johns Hopkins University, an AI model monitors ICU patients in real time, scanning for earliest signs of sepsis, a deadly infection that can overwhelm the body rather fast. This system alerts doctors up to 12 hours before symptoms even appear, reducing mortality by 18%. In neurology, AI can predict Alzheimer's disease in certain ways by looking at clinical, genetic, and image data. Its accuracy matches that of PET scans, but a fraction of the cost it is. Imagine the impact this can have in early detection, family planning, and preventive care where models have become standards in every hospital. AI is also redefining accessibility beyond diagnosis. It is extending medical expertise to corners of the world where doctors are scarce and resources are very thin. In India, AI-powered diabetic screen tools now operate in small and rural clinics where ophthalmologists might visit only once a year. This program itself has diagnosed 25,000 patients in 6 months, work that previously took 5 years. Thousands of people avoided preventive blindness because AI made expert diagnostics available in minutes, not months. In hospitals across the United States, AI is also using predictive to really think about administration management. Healthcare's biggest problems right now has to do with overcrowding. At the Mayo Clinic and others, AI forecasting systems may predict patient surges, which has created schedules for providing better for doctors and has cut emergency rooms connections for better care, decreasing the time by 50%. So as you can see, this is deeply transforming the hospitals themselves. Even the invisible backbone of healthcare is being transformed in the supply chain. Using deep learning techniques, AI is continuously adjusting inventory levels and making sure patients get the right medicine at the right time, at the right place. These have prevented from delays from happening. So as you can see, patients around the world can get access help based on this AI technology. And the next frontier that we see with AI is personal insights and adherence. It's beyond just creating accessibility. It also is empowering patients to become their active participants with their own healthcare. Right now, AI-driven healthcare apps, such as Omada Health Digital Diabetes, can help in personalized treatments for patients so they can follow diet, exercise. In clinical trials, these specific type of technologies have really helped the patients. And it goes beyond just going in person. The patient can take initiative and take control over this. Beyond that, the remotes and accessibility patients can actually get through their phones. They can track their heart rhythms, right, and arrhythmias. So right now, it actually can propose whether you're having a heart arrhythmia, and that can go directly to your doctor and be alerted, and they can take action for you to help. So as you can see, AI is really transforming, and it is transforming right now in many different dimensions. It is really impacting diagnosis, it's really impacting the services we provide, and it's also impacting personalized medicine. So based on this, what can AI actually do into the future, and what is coming up based on this? AI is still in its infancy if we think about it. Medicine is still transforming, and the transformation is happening daily. Right now, I'll talk about in 5 ways that I see AI really transforming medicine into the future. The first part is integration of genomics, lifestyle, and wearable data. Right now, our health data lives in silos. Your DNA lives in your lab, your diet is in your apps, and the rate of smartwatches. And your medical histories within, let's say, your medical records. What we see into the future is AI could merge all of this into a combination to be able to be analyzed. Imagine an AI system that learns from your body. Like it is like Google Maps. It gives you directions, it gives you the structure, and it updates constantly so you're able to know how it's going to happen in your body. By combining this genetic sequencing, your daily behaviors, and real-time biosensor data that exists, AI can create a digital footprint about yourself and use this. It wouldn't replace your doctor's judgment, which is keyword. It would give your doctor a living, data-driven portrait of yourself that can be helpful. Instead of reacting to symptoms, care will become anticipatory, individuals, and precise. This medicine is that learns from you, not that guesses about you, because it could use all your information to one specific place. The second thing where AI is really what transformed, it is predicting diseases years ahead in advance. Today, most diseases really are discovered after the damage has passed. In the future, AI could identify these specific diseases decades before they even start. Markers of heart disease in your early 20s, early changes in your brain chemistry, also foreshadowing dementia. Thinking as a forecasting help, this will be able to see what's going to happen into the future. That doesn't mean the prediction is destiny. It means opportunity for doctors to use this to treat you. AI can guide you towards preventive medicines, tailored diets, or personalized diabetes that delay or even prevent the disease altogether. So as you can see, it really can prevent a lot of diseases into the future. Furthermore, it will help preserve your health, not just treat illness. For centuries, medicine has really been built on a single logic. Wait until someone gets sick and they treat it. AI could help us flip that paradigm around. Future systems might obtain a digital twin of your body. So using all the information that you currently have, it create a virtual replica of yourself that stimulates how you will respond to different interventions before you even have to try them. Doctors could use drug combinations in there to test it, life changes, or surgical outcomes to see what will come out of it. This will allow healthcare to become proactive and continuous, not just reactive, adjusting your wellness plans daily. The best treatment could one day be the one that you never actually needed. AI will stay healthier enough to avoid it, so you'll be able to be proactive about this. Most importantly, one of the things that AI really will transform is the development of new medicines and treatments. Drug discovery is one of the most expensive, time-consuming processes in healthcare. AI has the potential to reinvent the process from the ground up. In the future, machine learning can model continuous designs of these drugs, can create molecules designs of millions instantly, and also can screen them for safety and predict how they might even interact in humans, long before even the first experiment. AI could simulate entire clinical trials virtually, so you can create this. Identify which patient populations are the most likely to benefit from these, and also the side effects. That means fewer trials, faster approvals, and affordable treatments reaching patients sooner. It radicalized ethically the process. What it just usually takes 10 years for a drug to get approved and about $1 billion to get it will be reduced and be able to get to the patient in a faster way. And also AI goes beyond just the clinic itself and the doctors. It can also help replicate and change the healthcare systems in general. Can you imagine a hospital that can use predictive analytics and AI to allocate staff before even it's needed, or create more enhanced supply chains that will be able to produce global inventory so we don't stock out of medicines? AI could design adaptive models of care, new types of care that we can use, that is based less on outcomes for millions of patients. Instead of having fragmented systems that we currently have in the system, we will be able to react to any crisis we have. And it will operate as an intelligent system by being able to connect all these together. What that means in public health, AI can also forecast regional disease trends, optimize vaccine distributions, and identify where care deserts are forming for communities that could be impacted. And the last thing that I want to emphasize is how the vision of AI in medicine, it shouldn't be seen as a competition. It is a collaboration. The future of AI isn't AI versus doctor. That's quite critical. It should be seen as AI with doctor. The future, AI will take over repetitive tasks, very heavy tasks to do, and this will be screening to help physicians to act better and effective. Picture a physician walking into an exam room with an AI assistant system that analyzes patients' full history, compares global data, and suggests tailored options for the patient. This will give the doctor an ability to create solutions with the machine, not alone, which is critical to highlight. These are not guarantees, of course. These are choices that will happen. AI can build this future, but only if we design around people, not profits, around prevention, not reaction. If we get it right, the next decades of AI in healthcare can change our lives. But to reach that future responsibly, we must also confront the risk of AI in healthcare. The ethical and social perils that come with it when the power we're dealing with outcomes the principle. So as we look AI into the future, we also have to ask harder questions. What happens when power outruns our principles that we have? Every breakthrough in medicine, whether it's anesthesia, antibiotics, or gene editing, came with moral consequences. Artificial intelligence is no different than that. AI can heal faster, diagnose earlier as we saw, and it can really help into the future. But without ethical guardrails, it can also magnify inequities, violate privacy, and erode the human connection that defines care. So this section, I want to talk about 5 areas where AI promises meets its peril. I will talk about the dehumanization of care, emotional authenticity, the privacy and consent that we're facing, bias and inequities, and trust and accountability in the systems. Each one reminds us that progress without ethics isn't advancement, it's just acceleration. The first thing I want to talk about when we're talking about AI development is the dehumanization of actual care. AI is increasing managing patients' communications, chatbots that answer medical questions, virtual nurses that can check on symptoms, and even mental health assistants that can offer comfort after trauma. These systems are effective, but they are not empathetic. They can mimic compassion through words, but they cannot feel it. Imagine an AI mental health bot consoling someone after they lost a child. Those sentences may sound perfect, but the comfort is synthetic that you're facing. The ethical principle that we're facing here in these problems is what you call respects of persons. Patients are not just data points to be managed or optimized. They're human beings with emotional and moral worth. If we let AI handle too much of the patient interactions, we risk creating a healthcare system that is just fast and flawless, but hollow. As I often say, when care becomes a transaction with the machine, we risk curing the body with neglecting the soul. The next risk is emotional integrity, or rather the loss of it with AI. Some AI tools are designed to sound empathetic. They use the tone, the rhythms, and the phrasing to simulate compassion. Patients start to form emotional attachment to the systems, believing they care. But these systems can't feel, remember, or truly understand suffering. So the ethical question becomes, is it moral for AI to imitate feelings it cannot experience? If a patient confides in a chat box that says, "I'm here for you," but the system forgets that interaction the next day, is that honesty or is that manipulation? The danger isn't just that the AI pretends to care. It's that humans might start to accept imitation care as good care. The fourth thing I want to really talk about is about privacy that you confront with the systems. AI, specifically in hunger, is really based on endless data. Millions of medical records. It deals with scans, genomes, wearable readings. But most patients have no idea how their information is actually being used right now. In 2019, Google's project Nightingale recently partnered with Ascension Healthcare to access the medical records of millions of Americans without explicit patient consent. Legally, it was allowed. Ethically, it was alarming. Privacy isn't just about securing or compliance. It's about autonomy. When patients lose control of their own data, they lose control of their dignity. As I like to remember healthcare technologists, when people say, I trust my doctor, they don't mean I trust my data to train a machine I never heard of. Protecting privacy means protecting personhood. It's not a line of code, it is a moral contract that we face. Lastly, something that goes traditionally hand in hand with privacy is consent. Right now, traditional consent that we face in AI is a one-time thing. This data will help me with your treatment and be used then. But with AI, the same data is repurposed over and over, developing products or even sharing with law enforcement. How can we consent and inform about giving our data when patients cannot know all the future uses of this data? Ethically, we must move from informed consent to continuous consent, a living agreement that gives transparency and control at every step that we do. Because if we don't, trust erodes. And once trust is gone, even the most advanced technologists cannot repair this. The fourth peril that we'll be facing is bias and inequity. It may be the most dangerous of it all. AI learns from data and history. And history in itself, it is bias. In 2019, research discovered that a major healthcare algorithm used across the United States hospitals underestimated the health needs of Black patients by almost 50% because it used healthcare data costs as a proxy for healthcare. The system assumed that lowering spending meant better healthcare, when in reality, it reflected systematic inequity. This is what happens when we let biased data define fairness. The ethical principle I talk about here is justice. Fairness must be measured not only by the inputs, by its outcomes that we're having. If bias is baked into the systems, then inequity becomes automated. To fix this, we must use diverse data sets, community engagement, and constant auditing to ensure AI benefits everyone, not just those who built it. It's also important to talk about the trust and accountability in the systems. Clinicians and patients may over-rely on AI, assuming its recommendations are always objective or correct. But when AI gets it wrong, when it misdiagnoses, delays treatments, or misinterprets symptoms, who's accountable for this? Is it the programmer, the physician, the company? Automation bias makes it easy to defer to machines, right? But ethics demands that responsibility remains human. To trust To build trust, we must make AI transparent, explainable in how it reaches decisions, and always under human oversight. Because when no one is accountable, everyone is at risk. And in medicine, that risk means human costs. So where does this leave us? AI's greatest ethical risk isn't just what it can do, but what we allow it to do unchecked. Technology can process data, but it cannot process values. That's our job to do. And that's why in the next section of this presentation, I'll talk about the CARES framework. Why it's so important to use this framework when we think about AI. It kind of offers a roadmap to ensure that AI in medicine isn't just powerful, but it's principled and ethically used. Because the future of healthcare isn't about replacing people with machines. It's about ensuring technology serves humanity, not the other way around. After seeing the power of AI and the other ethical risks we just talked about, we need to move forward and ground this into a framework that can help us, which is why I created this framework called the CARES framework, which I just published in Forbes and will be coming up in other articles. What this framework is trying to establish is AI should be built and done in these 5 pillars. First, it has to be clinically accurate. 2, it has to be based on accessibility and equity. 3, it has to be based on responsibility and human oversight. 4th, it has to have the ethics within data privacy. And 5th, it has to have social accountability. Together, these 5 pillars offers a simple but yet powerful question we should ask every time we begin designing. Does this technology truly care about people? In using this framework, we can decide whether it does or it doesn't. The first principle that I want to talk about is the clinical accuracy of AI that we have to have. No matter how advanced an algorithm is, if it's not medically sound, it does not belong in healthcare. AI tools must be treated with verified, peer-reviewed, and ethically valued data, not any type of data. They should translate complex medical information into clear, accountable insights to both physician and patients. Too often, AI models are black boxes. They get answers without showing how they got there, and that is not acceptable. We need systems that can explain their reason so that doctors and patients can trust those decisions. So what does this mean in practice? First, accuracy of data begins even before an AI tool is ever used in a clinic. Models should be built in collaboration with clinicians, ethicists, and data scientists. They must be tested not just one, but continuously with people in different populations, hospitals, in different contexts. Training data should be verified in a diverse setting and free from bias that might distort outcomes as we talk. And every AI system should be extremely validated and audited for errors, the same way we review a new drug that we currently do, using those same process. Secondly, accuracy also means explainability by design. What I mean by that, we should build AI that shows its reasoning. Using confidence scores or virtual cues, this information should be presented to clinicians so they can understand what decisions they're making with this. Doctors should be able to understand what they're reading and why the algorithm is making those recommendations so they can actually make them for the patient. True clinical accuracy isn't just about getting the right answer. It's about earning trust through clarity, accountability, and evidence. The second pillar that I have is accessibility and equity. AI should serve everyone, not just those who design it. Across every language, every background, and every level of digital literacy. If we only design for those with the latest technology or the highest literacy, we end up deepening healthcare disparities rather than closing them. Accessibility also means designing for low resource settings, low bandwidth systems, multilingual interferences, and simple mobile tools that can reach rural areas or marginalized communities. Equity requires inclusive data sets that reflect the full diversity of the populations, because medicine that only works for some is not ethical medicine. So what does this actually look in practice when we want to design and create these systems? Best practices begin with inclusive design from day one. That means bringing patients, community leaders, and local clinicians into designing the process, and not just data scientists or CEOs. Data must be collected from diverse populations, different ages, races, and socioeconomic backgrounds, so that predictive models don't just represent and give information for those who are being represented. Accessibility also means meeting people where they actually are. That could mean developing mobile apps that work offline, voice interfaces for people with limited literacy, or AI translated into dozens of languages so people have accessibility to this. Hospitals and developers should invest in digital literacy programs that empower patients to understand and trust these AI tools. The most important thing, and the fourth pillar, is responsibility and human oversight. AI can support care. It shouldn't lead it. We should never replace a doctor. AI should complement a doctor. In healthcare, accountability must always remain with clinicians, researchers, and institutions, not with the algorithms themselves. This means creating clear escalation rules. For example, when an AI system flags a diagnosis that happens, that alert should go to a professional who will evaluate this, not a machine. The individual will have that final call to do it. It also means building a system with transparency into its governance, tracking who built it, how it was built, who is responsible for this. So every AI system should have an accountable structure, from design to deployment. Hospitals and companies must define who reviews AI outputs, how errors are reported, and what actions are taken with systems malfunctional. AI governance boards, composed of clinicians, ethicists, as well as engineers, should routinely monitor the models to make sure they are working properly. Humans should be part in the loop. They shouldn't be an outside of the loop. Second, responsibility means continuous human supervision, not just oversight at launch, which usually is what happens. Clinicians should receive training to understand AI tool strengths, limits, and the failures that it has. Institutions must monitor outcomes over time, sharing performances data transparently to others, with both regulators and the public so they understand what is working. And when AI becomes harm, accountability should be traceable, never diffuse across an organization, but given to a person. In short, AI may assist, but humans must always retain the moral and clinical decision making at the end of the day. Responsibility cannot be automated in this. The fourth principle is talking about the ethics and data privacy. So it's important to protect patients' data, as we talked about early on, because it could be used for other things. And it shouldn't just be a legal checkbox. It should be a moral way that we look at this. Since AI runs on data, that data represents real people. It's real lives, real stories. Every system should ensure transparent consent, encryption, and control of these data. Patients should know what the data they're collected and what is being used for. We need stronger standards for data preserving technologies. In medicine, data is really important, so we want to make sure we protect this. So what does that look like in practice to protect this data? It starts with transparency and choice in this case. Every patient should have the right to understand how their data fuels AI, how it's used, and consent should be continuous. It should not just be one time. Institutions should adopt privacy by design principles, embedding a lot of security and encryption in this. Beyond compliance, it also means shared accountability. Hospitals and researchers and tech developers must create unified data ethical frameworks that balance innovation with patients' rights. This includes independently ethical reviews of AI projects, transparency reports that disclose data sources. Ultimately, protecting data in these cases is protecting human dignity, so it's quite critical to do this. And the last thing is social accountability. So AI doesn't really exist in a vacuum. The company's institutions developing it must be answered to its impacts that it's doing. That means being open about the algorithms, undergoing independent audits, and measuring success not just in accuracy, but in human benefit that's happening. Social accountability also means involving communities and the governance that is being developed. So involving people to make sure these are being represented, other communities that it represents. What does that mean? It means should be disclosing the purpose, the limitations of these specific products. Independent ethicists should be able to evaluate this and provide feedback. And when harm does occur in instances, companies must have clear mechanisms of readiness when it does occur, remediation, and communication with affected communities. So as you can see, this framework gives you some of the practices that you can be seen in how to develop and change AI. So to bring it all together, to give you what these are kind of the 5 best practices that I think we look at when we're talking about developing AI. First is base AI on verifiable, up-to-date science information, as we talk about information that is scientifically proven. Designed for every user, every language, every ability. Make sure keeping humans in the loop of making these decisions. Protect patient data like a sacred trust because it all depends on that. And lastly, make sure it's transparent and community focused at the end of the day. If we allow all of these, AI can become a tool that can help the world. And a partner in building this. And it can create a compassionate healthcare system. Everything we talk about today, AI breakthroughs, its perils, and its CARES framework, lead us to one simple truth. The future of medicine won't be written in code alone. It will be written on values. Because no matter how advanced our algorithms become, they will always reflect the intentions, biases, and moral choices of the humans who designed them. Technology doesn't have a conscience. We do. AI can process millions of scans, but it can never feel a patient's fear. It can predict diseases, but it can never help someone. It can optimize supply chains, but it cannot understand what does it mean to provide those medicines to the patients. That's where we come in. Our role as clinicians, engineers, is not just to make AI smarter, but to make it wise and based on principles, to ensure that innovation never outruns compassion. And that's why the CARES framework gives us a compass for navigating this new world responsibly. So as we step into the future, I challenge all of you to just think differently. One, to build systems that explain, not just compute. Collect data that protects, not exploits. Design with inclusion, not assumption. And measure success by the lives improved, not just by the metrics achieved. Because this isn't just a technical project, it is a moral one. And if we get it right, if you infuse empathetically with justice accountability into every layer of the technology, then AI won't just change medicine. It can help us redefine what is it to mean to care. Thank you so much.
Any questions?
Hello, thank you for being here to give us this insight into AI in healthcare. I'd like to ask you what technology, or do you know of any technology currently used to spot the markers?
Sorry, can you repeat that again?
What technology is being used to mark any to spot markers? Do you know currently?
Markers in what regards?
Health diseases.
What they do, some markers they do is what genomics specifically that they use. So some of the genes that people give into the system, they can evaluate if they are specifically connected to a risk of some form as a marker in your gene, and you can utilize that to determine if there's a connection. And there's different models for different types of diseases for that.
So that would require a lot of blood lab work?
What it requires your blood. It also requires the sequencing of your DNA, right? It needs to come and sequence that DNA. Once that sequence has been done, then they compare it to see what does the model look like to those who do have the disease, and connect those together to see if there's a connection. But it does require blood because it requires to see the actual DNA sequences of that specific thing that you're looking at.
I just wondered,
It's on. Just talk close.
I was curious about what's happening in terms of predicting Alzheimer's and the outcome for patients who have it. Are they using AI that much?
Yeah, one of the things they're using is they have this theory with Alzheimer's that is based on some form of plaque that forms in the brain, and they're trying to connect it back to that, going back to the sequencing of the DNA, if there's a connection between some of the sequences and the creation of these plaques. The reality is the science is still very early on, so their connections are not still clearly made. So it's still in the process of being defined. But there is a lot of work being in that regards. And so there is trying to connect some of those theories regarding the plaques that do form in the brain, the specific genetic disposition of that, and linking together to see if there's a pattern. So that's one way they're looking at it. But there's so many other ways that they're also looking into it.
I had a question, like throughout the world, people are aging, right? Look at Japan and other countries, right? Robots are becoming the companions. Now, taking the cares and the AI is getting involved in robots, and Musk is talking about humanoids in the future. What's your say on that, What's your say, like how it should evolve and help the aged and elderly? Yeah.
I do think as we evolve and robots and AI come in, I go back to the principles of this. I think we could use AI for the benefit of society. It's just how we design it, what our focus is, and how we structure it. And so we focus on these values and these principles that I mentioned as we design this technology into the future. It definitely can give us better outcomes that will help society, that will benefit the common good. I think as a reality, we have to be really grounded on this. If we don't ground ourselves in those principles, then definitely you can have a technology that can go a different direction. So this is why we have to make sure as we design this and create this into the future, it has to be grounded in this morality. Otherwise, we are designing technology that might not benefit everyone and might not benefit the common good and people. So it's quite critical to drown ourselves in those morals. Technology can be created, but the reality is the way that we also structure has to be based on the morality of it.
Just a couple of observations. One, I'm concerned about whether AI might perpetuate the growing ageism by parts of the medical profession. In other words, an ageism attitude that is treating older people within a box. Second thing is, I have noticed more and more that doctors' reports are AI enabled, and unfortunately, therefore contain a lot of vagaries rather than specifics.
Yeah, your second point, a lot of the information that's being even transcribed or your doctor uses, sometimes they use AI-generated information that gets picked up and they use. I think I go back to the point about privacy, and a lot of this privacy has not been kind of caught up to the reality of the technology, right? The technology has advanced, but we haven't created policies talking about protecting those privacies, right? Because you consent once and you consent once. But the reality is like this is being used, and sometimes doctors will ask you if you want them to use AI to take notes, to do this. Other times they don't. So there isn't like a common practice of being used. And so as you can see, a lot of these policies that do exist currently have not caught up to the technology. And so this is where you kind of have to start thinking, how do we get these policies of being within using with the patients and patient rights to make sure these policies do represent this. And this is where we start creating systems that should reflect that. Regarding your first question about ageism, can you repeat, can you verify, can you tell me a little more about what you mean by that?
Probably every senior here has sensed this, but that a certain part of the medical establishment has an age bias, not in favor, but essentially treating an older individual's medical issues as though, well, you know, it's going to go away because they're going to go away.
Really? That's what I say.
And I'm concerned that AI might perpetuate that.
And it goes back to the question, technology is only a tool, right? It's a tool that we design to help us, but how we design it. So thinking about how do we design that tool specifically in making sure we go back to those principles to make sure we hold that dignity within people who are in a specific age, or thinking them as human and their actual rights, designing that technology with that in mind and keeping those principles in line will kind of help a technology that will look for those individuals, right? And so that's why it's critical to design it towards this kind of framework that I was talking about. So the technology, when it is designed, it is helping those being served. Just remember, technology is only a tool. How it gets produced and what it ends up doing is based on what we decide to do it, right? And if we want to create technology that's principled, we need to use those principles to move a technology that is based on those principles.
Hi. I work in some facets within AI in my industry, and one of the things that we're doing is we're partnering with what's called the Happiness Institute, essentially asking the question of, will AI actually make a person happier, right? For instance, if I knew everything about my body, will I be happier, especially if there's not a solution, right? So like, how do you address those questions of happiness and how AI will actually help a person be happier, right? Where you cross into that meaning zone of AI.
Yeah, and I go back to the question, like, what exactly do you want the technology to do, right, and ground that? And I keep emphasizing in these cases, even with happiness, I think that technology should be a complement. It doesn't substitute something. So a technology should complement and help a doctor or a therapist, but it shouldn't really substitute that person. It only enhances their tools. Because the reality is humans were capable of doing more than AI can do, right? At this moment, AI doesn't have the capabilities to be human and have that emotion, that conscious, the ability to do these things. And so it's not like it can substitute us. And it shouldn't substitute us in these cases. So regarding happiness itself, if what brings happiness might not be the tool, but it should be how you live life, and that can be enhanced by working with individuals, not so much with technology. I think that's what's critical. It's an enhancement. It shouldn't be a replacement for anything.
Yeah, just wondering, kind of off topic, are you concerned with the energy costs associated with AI? And how, I mean, obviously, I think in healthcare, I think it's worth it, but it's definitely a cost to consider.
Yeah, it's a big concern because it does require so much energy and so much water, and so it does require a lot of energy. So it takes a lot of, and it also another thing that happens. The places where this is being placed, it takes the water from them and it makes it unsustainable for those places. So there's the risk-benefit analysis that does have to occur. Is what we actually improving worth the risk and the cost of deterring the environment? And that's some of the calculation that does have to be considered. But it's a huge, huge problem.
Just shameless plug. I work at the Markkula Center, and I have an op-ed on that in today's Mercury News. So we're definitely paying attention to the issue. But I wanted to ask you, can you give us an example of a particular health-related AI that you think has been really effective and worth, the cost, and then one where you think maybe it missed the mark, like some specific examples?
Yeah, an example that I think has been effective, I go back to what we saw about using to diagnose specific diseases, right? We talked about using it to think about sepsis and thinking about whether it was going to be able to change that, and it created a lot of good within the place, right? It was able to reduce mortality by 18%. And so use it as a diagnosis tool was a great tool. One way where it hasn't been well designed, and there's an example of using almost as a substitute to doctors or a therapist. And we have seen where there's been a lot of consequences in the news where people have taken their own lives or because they have really relied on these systems. And it go back to the reality is that goes against, is not human-centered, right? It doesn't put the doctor as, or the therapist as the one who makes the decisions. It allows these systems to just operate by themselves and make these decisions. So in that case, it's not founded on that, and those systems will create harm, will create these things. So I think because of that, those systems like that are harmful to society.